Well, initially I was going into business, and I guess it was winter quarter of my senior year at Georgia Tech. I called my dad up, who was a local orthopedist, and I'd never watched him do surgery before, and I said, I want to come down and see you do some surgery. And he said, come on. And we arranged to go, I guess it was the medical center at that point, and watched him fix a broken hip. And I think at that point I was pretty much hooked. I felt like that I could do that every day, using my hands, helping people. I like the complexity of the decision-making process that goes into deciding who you operate on, what the techniques are. It was a lot more, intricate in my mind compared to doing some of the other parts of orthopedics. Although I enjoyed those, I liked the surgery a lot and the decision-making process that went into it. The Middle Georgia area is home, and I left for all my training. Went to Georgia Tech in Atlanta, then Augusta for medical school, then went to Memphis for my orthopedic residency, and then came back to Macon and practiced for a year doing general orthopedics, and then ended up going back to my fellowship out in Denver and visiting all these places. I really loved them. However, I was drawn back to Macon well, it's mainly the people. They're what keep me happy and keep me motivated to keep doing what I'm doing. You hear advertisements on television and in the print media of laser surgery and minimally invasive surgery, and the fact of the matter is there are only a few patients that you would use a really laser type surgery on. Minimally invasive is kind of the term we use in the field more so than laser surgery, because there are very few places that actually use a true laser to do spine surgery. But we all here at OrthoGeorgia, and myself in particular, we all perform minimally invasive type procedures in the right patient. And I think anybody would want to have a minimally invasive procedure if it's a good option. However, sometimes it's not a good option, and you need to know the difference. To think that every problem is treated with a Band-Aid is not realistic. Sometimes you have to have a big surgery, and sometimes you need a small surgery. And I think trying to decide between those two options is what's difficult sometimes, but what's very important to spend the time to dig out those details. Most back pain can be treated through your primary care doctor with a brief period of rest followed by physical therapy, anti-inflammatory medicines, those kind of things. If people have symptoms of leg pain or arm pain because they may have a pinched nerve and that's not going away with the conservative treatment, then we'll start getting MRI scans and looking into it further.